Well, a nationwide nursing shortage existed before the pandemic, and being on the front lines of fighting COVID caused higher turnover rates than ever before. Indiana University is responding by increasing enrollment to swell the ranks of nurses. Business of Health reporter Kylie Valletta has more.
Thank you, Gary. The IU School of Nursing dean says this is a high urgency issue, so the school is expanding its nursing program on all 3 campuses throughout the state. IUPUI will see the biggest boost with a 50% enrollment increase based on a $16 million gift from IU Health. IU Fort Wayne and IU Bloomington are also adding spots to train more nurses. IU School of Nursing Dean Robin Newhouse joins me now to tell us more. Thanks for being on the show today.
My pleasure.
All right, let's talk about the shortage. We established that exists, but why is it such a serious problem that we should all care about?
Well, it's a serious problem because it's not only an economic problem, it's a clinical problem and it's a health problem. The urgent need for nurses makes us concerned that people won't get the care that they need. Nursing in particular, one of the largest clinical professions, has a profound role to improve the health of the population. Nurses themselves are trained in a lot of different ways. They work in multiple settings. The outcomes associated with nursing are important and promote health. So let me just start by saying what nurses do. Nurses prevent injury, they promote health, they diagnose and treat the human response to different phenomena, pain. The outcomes that are associated with nurses are related to clinical outcomes like I mentioned, pain management, also decrease infections, nosocomial or hospital-acquired infections, falls, as well as patient experience. Nursing has a role in patient experience that increases satisfaction by patients as well. In addition, length of stay is lower, as well as the return to the hospital or readmission to the hospital. So nursing is important for a number of ways. In fact, one of the issues, nursing is so important, the Bureau of Health Professions are predicting that nursing is going to be one of the most important jobs for growth, and because of the need for nurses.
So I know that we don't like to focus on the numbers a lot in these stories because you say, you know, nurses aren't numbers, they're not widgets, and I know you're very passionate about that. So I think we do want to talk about, though, IU being unique in the sense that it provides a full spectrum of nurses and the way that it trains nurses, everything from beginner nurses on. Can you explain that just a little bit?
Yes, I'm glad you brought that up. The nurses, when we talk about entry-level nurses, so all the discussion about we need more nurses, people are talking about entry-level nurses. They're generally at the associate degree level or the baccalaureate level. So Indiana University offers a baccalaureate level. Associate degree nurse and a baccalaureate nurse will sit for their licensing exam at the end of their program. Indiana University also includes a set of graduate programs and tracks as well. At the graduate level, a master's in nursing, we have 5 nurse practitioner tracks. Nurse practitioners are those clinicians that work in primary care or acute care that diagnose and treat people. This is an opportunity for us across the state to employ nurse practitioners. You know, we have counties that don't have enough healthcare clinicians and providers, and nurse practitioners are a solution to that. In addition, we train clinical nurse specialists who are also known for the ability to manage populations of people and improve outcomes, reducing the cost of care as well. Nurse practitioner, the quality, safety, and effectiveness of nurse practitioners are undeniable.
And I know there's a need for all of those nurses right now with this shortage. I'm so sorry, but we're already out of time. I know there's also some expansion happening on IUPUI campus because of this money from IU Health. So good luck with that and keep us posted on those numbers.
Thank you.